So keeping with my announcements, it's still tied, and they're in extra time. And then we'd like to now have the agency panel together that Jennifer will moderate.
So while we're transitioning, why doesn't everybody just stand up and take a quick stretch? We're in the 7th inning. Well, okay, we're past that. Okay, stretch time is over. If we could have everybody take their seats again, please, and we'll keep this moving along. So as Dr. Rao gave us a great introduction, we are from the government, and we are here to help you. Trust us. I wish it were as easy as that. Yeah, so this is the agency panel. My name, again, is Jennifer Orme-Zavaleta. I'm with EPA's Office of Research and Development. We're running about 30 minutes past time, and so what we would like to do with this session is we'll have each of the panelists introduce themselves, talk a little bit about their organizations, and then their perspectives on the conversation that we had in our group. We had a great group. Everybody well engaged, wide representation across the federal sector, some state sectors, some community perspectives as well. So I think they'll share their perspectives, and then we'll open it up for a few questions, and then transition on to the next panel, just to catch us up a little bit. So with that, I'm going to turn to Linda Birnbaum, and she'll introduce herself, and we'll move on.
So I'm the director of both the National Institute of Environmental Health Sciences, which is one of the 27 institutes and centers of the NIH. We're the only one that's not located in Bethesda, Maryland. We're in North Carolina. And we are, I would say, the major institute of NIH that focuses very much on public health and prevention as opposed to treatment and cures. That doesn't mean we don't do some work related to treatment and cures, but we'd much rather prevent disease than have to treat it and try to cure it later on. We have, like any NIH institute, we have we have two robust intramural programs, one of which is the National Toxicology Program, which also involves part of, well, I should say NIEHS, part of CDC, and ATSDR, part of the FDA. And the mission of the NTP is not basic biomedical research, but is developing testing, doing testing, coordinating testing across the government, and also evaluating the results. So we are legislatively mandated to issue the report on carcinogens and also other kinds of evaluation. For example, the looking at alternative methods, and we run a 16-member federal agency member looking at alternatives for testing as we go forward. We also have, like any NIH institute or center, most of our money leaves North Carolina and leaves the institute and goes into our grants program, where we fund over 1,000 grants in 39 states and 35 foreign countries as well. And again, while much focuses on basic biomedical research, we also have a Superfund program, which is a typical actually comes from the same appropriations committee that fund EPA or ATSDR, is not the normal NIH kind of funding. And that is two parts. One is doing basic research to understand the hazards and develop remediation technologies related to hazardous waste sites and hazardous exposures. And then the other part of what we have is we run a program related to worker training in emergency response and hazardous waste cleanup. Again, very non-NIH kind of things. So that being said, we have actually, I would say, been drivers and are very excited to see the EUMHI beginning to come to fruition. We've been working on helping the agency to move in this direction for several years because we saw the need for the multi-sectorial, multi-agency involvement kind of approach. What I heard in our, I would say, very large, very group that was very excited and wanted to share information, a couple great ideas. First, that EHMI effort maybe could establish an environmental health caucus for Congress. Obviously, this is not something that any of us up here can have anything to do with, except to cheer, but I think that would be a great kind of idea. I think while it is clear, or it's very important that to many of us, although our mandates may say stay in your lane, that is anathema, and that we really need the vibrant liaison group that crosses levels of government. We support greatly the idea, and I say we, that was the whole group, focus on wicked problems. There's tremendous credibility, expertise that EHMI can, which is what people need in order to trust what anyone would say. We did, the idea of health in all policy resonates with us. You know, what happens to animals, what happens to ecology, what happens to people, everything is integrated. Again, the focus on prevention. We felt that EHMI could provide legitimacy, advocacy, and support. I heard several of the other groups mention this group, the importance of getting ahead of the curve. Instead of trying to evaluate something that's a problem that's already happened, let's look forward and build forecasting kind of tools, and all the different parts of EHMI need to bring their toys to the table, or I should say all the different parts of the federal government and the states and the locals, not forgetting you, should bring them to the table. Part of the promise of EHMI is to message across the sectors. That again, and then another, I thought, very important comment that came up is that different agencies, again, both federal, state, and local, have huge amounts of data, and we need to maybe help develop an approach to warehouse that data so that everyone could have access to it. We need to take an integrated systems approach, that we need to remember that environmental health is exceedingly diverse, and the importance of using language that everybody could understand. So I'm sorry, Tracy, I don't know if you're here, you just said RCTs, and I'm not sure if anyone, certainly our engineers, might not understand that that's a random clinical trial and a randomized clinical trial. And so again, we need to be sure that we can talk to each other. And one thing that I took from this morning and came back to our discussion group was thinking about the fundamental paradigm of economics as we go forward.
Great. Thank you, Linda. Moving on to Pat.
Great, thank you. So I represent two groups. The first one is the National Center for Environmental Health, and that's one of the centers at the CDC. Obviously, it's a non-communicable disease center. And the Center for Environmental Health has a number of programs to support efforts at state and local level. These include, we have programs in asthma, lead, water and health, climate and health, food safety. We have a public health tracking program, which in many ways is attempting to integrate things perhaps along the lines that we're talking about today. We do emergency response, and we also have the laboratory at the Center for Environmental Health is a national resource for biomonitoring, which was mentioned before. Well, there's more than just biomonitoring. It really is one of the premier resources in the world for biomonitoring methods development and biomonitoring going forward. And then in addition, I'm the head of the Agency for Toxic Substances and Disease Registry, ATSDR, which has a mandate to be a health counterpart with the EPA to address community concerns about hazardous waste sites and hazardous material spills across the country. And so we're currently involved with over 100 hazardous waste sites at this time in every state in the country except for one. And so we have a large mandate, and we're working hard to address those community concerns. So Linda actually did a very good summary of what we talked about. I just want to touch on a couple things and maybe emphasize a couple things in addition. So part of what we're here to do today, and part of what we're relying on the National Academies for, is to make a safe space for us to get out of our lanes and get away from the need that we have in our everyday job to try and stay in our lanes and try and respect the work and the mandate that our fellow colleagues have at the federal government. And so we look to this, and we look to the academies to provide that safe space, because we recognize that while our everyday jobs might require us to be a little bit more focused, a little bit narrower, and stay in our silos, to address environmental health writ large, we can't do that. And I just want to mention something that Governor Geringer mentioned. And part of that safe space is creating an environment where we can talk about things. And he referred to what he used to implement in Wyoming when he was governor, a safe space to discuss things that brought multiple government agencies across levels of government together. He called the kitchen table a democracy. So he's the notion that people feel comfortable sitting in a kitchen talking about things. And so what I recommend is that the Academy invest in a conference room that's got a kitchen in it, with a big table, and a refrigerator, and maybe a glass of wine, a bottle of wine in the refrigerator.
Sorry, we can't fund that, though.
And so we have our next meeting in that safe space modeled after a kitchen. And another thing I'd like to mention is that there is a feeling that there's a lot of data that's being collected by a wide number of agencies that including the health-based agencies, but also agencies that are not health-based. And we need to figure out ways to kind of integrate those data, capture those data, as Linda mentioned that. But that creates a big data analytics burden. And we have partners who are skilled at that. For example, NOAA, and they're, as an agency, while they don't have a direct health mandate, they're very skilled at taking data and making predictions and forecasting about data. And so utilizing those skills to help us get on top of all this would be an important thing. And I think I'll just stop there.
Great. Thanks. On to Lauren.
Okay, so Lauren Zeise. I'm Director of the Office of Environmental Health Hazard Assessment within the California EPA, and we provide science analysis to support regulatory decision-making in California. And a lot of problems that crop up in the state come to us for answer science problems like, oh, we have these kinds of chemicals in our water, is it an issue? How can we better address community concerns for cumulative exposures? These kinds of facilities are going to be sited in our neighborhoods. Should they be? These kinds of questions. So, and there are a lot of wicked problems that persist. And so Pat and Linda did a beautiful job summing up the discussion of the session. So I'll just highlight a couple extra things. And that's that I think we got pretty good coherence maybe across all of our panels that somehow human health has to be more predominant in sustainability thinking. And I know there's been a big debate in the sustainability community about how many pillars there are, and a desire to stick to three of them, social, environmental, and economic. But it seems human health really needs to be part of that, and it's been missing. So I think that came out of our discussion pretty clear that human health really needs to be much more visible in sustainability discussions. I guess around solutions to wicked, so the cultural change associated with this initiative, this got a lot of promise, and in thinking about the kind of wicked problems that we need to focus on, I think a lot of different has come up with, they need to be practical, something practical, doable, difficult, and visible to kind of get some credibility to this initiative. There's discussion of different topics that cut across different dimensions of the problem. Human right to water is one that kind of cuts across engineering for accessibility, affordability, and water quality. These kinds of issues would be ones that would be topics that would be great for the Academy to tackle and ones that the states could really benefit from. And I guess in thinking about the selection, whatever topics are chosen, and I think Tracy mentioned this, it's really important to have sort of models that we can build on. So case studies and models that we can build on as these topics are chosen. So that we can then take them and move forward. And of course, uncertainty analysis in whatever we pick, at whatever is chosen as a topic, uncertainty is going to be a part of it. So I think maybe using uncertainty as a lens for picking a topic where it's not so huge that you're kind of stymied, but that the Academy committee can, or the Academy process can move forward with it. And I guess I'll end with that.
I could just highlight a little bit too about the importance of state and local. Is there was a nice observation made that if we just think of from the federal government, it's too much of a top-down approach, and getting the state and local health officials involved makes it a bottom-up. And if we have a bottom-up approach, meaning the top-down approach, we're probably going to hit things right. And so that's a crucial component of, I think, how we need to move forward. And I'll just mention very quickly also that a group that seems to be missing, and I know we've talked about it before, but it's come a couple times today, is tribal groups as well. We have to make sure that we have, I think, some tribal representation going forward.
And I just want to say one thing related to uncertainty, is I never ran an experiment that didn't raise more questions than it answered, even your best experiment. So somehow we need to change the dialogue about what uncertainty really means.
Or the study design.
It's
I'm teasing you.
You know, and
it's been a long time since she's been at the bench.
I think if we pick I think if there's a topic chosen that is particularly difficult and really implementation facing, then again, you can use that to serve as a model for how do we move forward in this.
So we've used the problem solver time.
Yeah, so who said the government couldn't be efficient? So let's open it up now for, we have time for a couple of questions, and then we can move on to the last panel. So any questions?
I'll make one comment, which is, I know one of the questions that people wanted to ask was a question about funding, right? And, you know, at least of those of us sitting up here, I'm the one with the deep pockets, comparatively to the others, but they're very small compared to the rest of NIH. My total budget is about 2.3 to 2.4% of the overall NIH budget. And our percentage has decreased over the past couple of years because NIH is a favorite stepchild, if you want to say. And so we have gotten funding increases, but large amounts of those have been earmarked to specific topics that often, that explicitly don't include environmental health.
I can just also remind people that these initiatives take resources. And while some of us have stepped up with resources from our agencies, we encourage everybody to consider the opportunity to support this initiative going forward. If we want to make it successful, it's going to need other people to step up and provide resources to the academies.
So with that, a question? Yeah, no, you're there.
Oh, so I'm Christy Pullen-Fedenik at NRDC. So just a quick question and hopefully maybe longer quick answers. What are you all most afraid of, and how could this initiative help that? Right, so it could be, you know, afraid of from a funding perspective, or from, you know, something that you see on the horizon as being a major health, let's say, opportunity to be able to address. But what are the things that you're most fearful of, and is there a way for the EHMI to address that? So
maybe I can jump in on one thought. So as we think about implementation, and we talked a lot about implementation, in some ways it depends on the type of problem that you're looking at. And, you know, as was mentioned earlier this morning, there's a variety of different tools for actions. You know, regulations can be one of them. But as we think about our science differently, we have to think about, so what do the implementers do with that science? How, if our laws, our environmental laws, are siloed, how do we expand the thinking of those laws so that we can be more holistic and really solutions oriented in trying to solve problems? And so it's going to be we're going to need to help the risk managers, if you will, the users of this information, understand what it means and how it will help them with whatever decisions they need to make. That's just from my perspective.
Just really quick. So wicked problems, when they become front and center, communities require, need, demand action. And if we don't start thinking more practically about stuff as before the stuff hits the fan, we won't be well served, because we're always going to be behind the ball, and we need to get in front of the ball.
I think that it's really important, as Pat said before, that we take some of our guidance from our communities, because they know what their environmental health challenges that are facing them. And I think the other thing is, as this initiative gets going, it better pick some low-hanging fruit in order for it to survive, to look and win its Nobel Prize.
Thank you. You sort of, Patrick and Linda, answered part of my question. I was thinking about all of the engagement that you all do on the grassroots level and how it does become a problem, trying to communicate the science, the risk, the issue with people who just need their problem solved. And particularly with NCEH and ATSDR, Patrick, I was thinking, are there lessons learned that you can convey to this effort from all of the public engagement that you all have done? For example, I've been in rooms where, FONSI is a really bad term for the community, because it implies that you don't think our problem is important. It says our finding is of no significant impact. That's what a FONSI is, but it says to the community, you don't think our problem is important, or you don't think we're important. And if all of you could, and if you have already done some lessons learned or gathered that information, that needs to be passed on to this effort, because I can see us really hitting some big issues with communities.
And we could take an hour to discuss this or more, so we're not going to do that now, but the answer is yes. I hope to bring that to the discussions. And we do need to do a better job of understanding what the community needs are, and that we do a better job of communicating what the limitations of what we can and can't say on their behalf. And from my experience, if we do that early, and we do that in an open, a two-way manner, everybody's better served. When we engage in that communication when it's late, when we're wrapping up the process, and that's when things fall apart. So we need to do that engagement early, often, and make it transparent and two-way.
All right. Well, thank you all very much, and thank you to the panel.